Hello, Renovo family. This is Kelly Calabrese, and today I'm here with Dr. Jill Costello in Ocala. Welcome, Jill.
Hello, how are you doing?
Great. So thankful you're with us. So your practice is Magnolia Sport Horses, and you focus on equine lameness and imaging. Tell us a little bit more about what you do.
Yep. So I'm based in Ocala, like you said. My practice focuses on poor performance issues. So beyond the typical lameness problems or really kind of difficult to diagnose lamenesses. So I do a lot of soft tissue injuries, back pain, neck pain, that kind of stuff.
Wow, that is awesome. Love that specialty, the things that you do. And is it more of a boutique size or are you a larger facility?
Pretty small. I work primarily out of my truck, so I travel the whole state of Florida if I need to. So it's just me at the moment. So can be very focused on specific set of clients or specific horses if I need to, which is kind of a really nice thing for some of my more difficult cases.
That is a great niche, and love that you're mobile, so needed. So tell us how you heard about Renovo.
So I actually heard about Renovo from Christian, the founder, and Ginger. They reached out to me and said, we have this new placenta-based product, and we would love to get it into some more practices, and would I like to try it? And I looked up a little bit of the science in it and thought, yeah, this looks great. Let's try it. So I've used it in quite a few cases now and been pretty happy with it.
Excellent. Can you tell us about some of the cases?
Yeah, sure. So one of the best cases that turned out really well is one that we're just about to do our 1-year follow-up on. It's a older show jumping mare, and she wound up rupturing about 85% of her deep digital flexor tendon in her pastern. We were all kind of surprised that she could still actually walk at all when we put the ultrasound probe on her. So it was a little bit of a last ditch effort for her to see if we could get her pasture sound. Her original ultrasounds, we couldn't even actually make out what was supposed to be flexor tendon or sesamoidian ligaments or anything. It was just kind of a big blob of tissue. So we put 3 cc's of Renovo through her pastern, ultrasound guided. And then when we rechecked her about 6 weeks later, we could already see some of the normal structure anatomy coming back in. We could actually see where there was supposed to be flexor tendon, see the straight sesamoidian ligament coming back in. And she was surprisingly more comfortable than we thought she would be. She was in a wedge shoe and actually doing really well. So now I think we're about 10 months out from that, and she's just gotten better and better and better. And she's in a flat shoe, and she's actually really sound and doing well in turnout on her own. So she might get to come back as kind of a walk, trot, canter, happy horse. And we were not sure we could save her, but it looks like Renovo in there actually helped pull a whole lot of more normal tissue as opposed to forming a whole lot of scar tissue in there. So that's been kind of the biggest wow case that I've used it on.
That is really exciting, and we love to hear that the horse is more comfortable as well. Obviously, that's so valuable. We love to see that. How about another case that you can share?
Yeah, another one. I had an eventer who did something silly in the paddock one night and wound up having about a 50% core lesion in a lateral oblique sesamoidian ligament, so one of the small ligaments at the back of the fetlock. And he's a bit of a wild child, so we weren't really sure how well he was going to do being quiet and rehabbing. So we thought we'd give him the best shot we could, the best product in that we could. So did a cc and a half of Renovo in his tendon sheath, and then a little bit intralesionally in that one because it's such a small space. And 6 weeks later on him, the original core lesion that was in that sesamoidian ligament had almost completely filled in, and he had no effusion in his tendon sheath. So we were, again, pleasantly surprised by that one. He Was sound a couple weeks after that, and was back in full work about 4 months later, and did really, really well. So that was one of my other favorite cases with it.
Wow, that is fantastic. We love hearing these stories. Can you share maybe one more?
Yeah, definitely. Trying to think if I have some other besides ligament. Yeah. So I had another horse that had a superficial digital flexor tendon tear through her fetlock canal in a hind leg. This one's more recent, actually. We're still in the kind of the middle of rehabbing her. It's about 1.5 inches long and 2 or 3 millimeters deep, so fairly deep for a flexor tendon tear. She was 4 out of 5, sent her to surgery, and then the week after surgery, we injected with another 1.5 cc of Renovo. She has no effusion in her tendon sheath. She's almost completely sound, which we didn't think we'd get her sound at all based on how painful she was starting out. But she's getting back into work now. The lesion can't see on ultrasound. It was really hard to see on ultrasound to begin with, but now we can't see it at all. She has no effusion in her tendon sheath. She's not sore to palpation at all. So we're just working her through rehab, getting everything stretched back out. And I think she should, knock on wood, hopefully come back completely sound, because we're only about 4 months out from surgery on her. So.
Wow, well, all of those details are so helpful and obviously specific to vets. What would you say to some of the other veterinarians who have not yet tried Renovo?
I'd probably tell them that it is a great tool to have for anything soft tissue that is a pretty significant injury that we need the extra bump from stem cells, but you don't have to wait for actual stem cells. We don't have that 3 or 4 week waiting time. We don't have to worry about problems with the culture. We don't have to worry about shipping them in from labs and keeping them, the exact right temperature. It's so helpful to have a product that has so much of the power of stem cells without having to maintain the actual little cells that are in there. And then also because it's placenta derived, we have some of the trophoblast tissue, which acts as a really great scaffold for building new healthy tissue on. So I've had great experiences with it so far without any of the problems that I've had using conventional stem cell therapy or conventional PRP, where we're worried about needle size for injecting. We don't want to lyse any cells while we're injecting. We don't have that problem with Renovo. So I think it's a great product. There's a whole lot of more research that can be done with it, and probably help a whole lot more horses with some less expense and a little bit easier of a procedure.
Wow, well, that is so helpful. We appreciate those words. And as a smaller practice, have you been able to just order a single dose versus having to get, a whole freezer full? Has that been helpful for you on the road?
Yeah, that's really helpful. I can usually get them the next day or the day after if I need them that quickly. Don't have to buy a bunch at once, or I can. So it's really, really helpful. And everybody at Renovo is super easy to talk to and easy to get in touch with. And if I ever have questions about anything, they're always there to answer the phone or answer my emails in the middle of the night. So I've really had a good time working with them.
Well, we definitely appreciate all of that feedback. We are really trying our best at corporate headquarters and with all the research we're doing, and just, having the support out there for you, in the field, in the trenches, who need the support immediately. So Dr. Jill, thank you so much for your time. We know you're super busy. Be safe out there on the road, and we appreciate all that you're doing for the equine world.
Thank you so much.
You're welcome.